person with chronic anemia, you know, anemia is an interesting thing because, you know, the normal way is it's just about iron, and you just put more iron in and then you make more red blood cells and then you're less anemic. But here's one sort of interesting point about it. Human beings, people, men and women, seem to have a set point of their blood levels. And not only that, but men and women have different set points. In other words, even if you take a non-menstruating woman or like a pre-puberty girl, they on average have a lower iron level than a similar aged male. And then again, postmenopausal, same thing. Men have higher iron levels, higher red blood cell levels than women do. And the usual explanation is, well, that's because women have this monthly cycle and they lose blood, and so they have to keep up, and that accounts for it. But even if you take 30-year-old women who, for whatever reason, are not menstruating, they also, not every individual one, but typically have lower iron levels and red blood cell levels than their counterpart men. So the reason I bring that up is it tells you that there's something about their body which is wanting a level of such and such. And no matter what you do, in most cases, you can't budge that level. So you can feed them liver and red meat and spinach and iron pills and vitamin C to help it get absorbed, and they never really budge from that set level. Now, when if you're talking about somebody who's like had bleeding or has some other disease, or some issue that's causing them to be anemic, i.e. have a low iron level, which is not their usual set point, those you can influence by those things, you know, feeding iron-rich food, usually with vitamin C or sauerkraut or something to help the iron get absorbed. But you can only bring it up to that set level, which is their body's decision, for lack of a better word. We want a, you know, hematocrit of 34. Now, why would the body want a hematocrit of 34 when, quote, normal is supposed to be like 38? So, and no matter what you seem to do, you can't budge that iron level. And again, if you take my line of thinking, which is that I always ask the question, why, if I was this body, would I keep my iron levels what most people, or at least some people, would call suboptimal? Now, the iron obviously is used to bring the oxygen to the tissues and cells, so you're keeping the person in a low oxygen state. Why is that? One of the reasons, and so it may not be obvious and it may not be the same with every person, but one reason is that iron that you can't assimilate into your physiology, you might say even into your being, acts as a very strong pro-oxidant and causes a lot of inflammation and destruction to the tissues. And so if you're not able to, you know, essentially have enough antioxidant or have, you know, protection of your tissues, the body might respond by lowering the iron levels, even though it may make you tired, but at least you don't have excess iron around making your tissues more inflamed. So in other words, it is a therapeutic response. to some problem, which the body doesn't want to have excess iron irritating the tissues. It could be that the excess iron is acting like some sort of magnetic receiver, even maybe of electromagnetic fields. And so if you're exposed to toxic electromagnetic fields, your body lowers the set point of the iron, even though it makes you tired and anemic, but at least you're not being poisoned by electromagnetic fields. So it's an innovative and brilliant strategy. And the solution then is not to give yourself more iron, but to get rid of the electromagnetic fields or eat more antioxidants if that's the case, or protect your tissues better from some sort of toxic poisoning insult or something like that. And then your body will be able to say, okay, now we can support these higher iron levels without it doing damage. In other words, if there's no negative electromagnetic fields, then you can have a higher iron level and you'll be fine. So that's always the way to do medicine and think about your health, is not to try to just make the iron level higher, because as you found out, that even doesn't work. Your body doesn't want it, it won't absorb it, it won't use it. It then has to sequester that in some place and actually make the situation worse. So you have to ask the question, why would the body do that? And it's usually because there's too much inflammation or too much electromagnetic field exposure. So the iron is acting like a magnetic antenna of some sorts, and your body doesn't want that.